Good afternoon, everybody. This is Congressman Scott Perry, and I want to welcome you to our COVID-19 or coronavirus town hall, and thank you for taking the time to join. This is an important call for everybody listening and for our entire community. Today I'm joined, and privileged to say I'm joined by Dr. John Goldman. He is an infectious disease specialist at UPMC Pinnacle, and George Donovus, a frontline nurse practitioner who's currently battling COVID-19 right here on the front lines of our community. And as you think about it, or if you think about it, unfortunately, our practitioners in hospitals might be one of the most dangerous places to be currently. So I really want to thank them for their efforts and for being on the call today. With that, I want to give you, before we hear from our two local experts, I want to just give you an update, and then it will all answer your questions. Of course, you know the outbreak of COVID-19 or coronavirus is a public health crisis in the United States. We haven't seen anything like this in over 100 years. According to CDC's update, there are 54,453 confirmed cases in the United States, with 737 reported deaths. Today, the Pennsylvania Department of Health confirmed an additional 276 cases in the last 24 hours, bringing our state's total to 1,127 cases with 11 confirmed deaths. Together, your federal, state, and local officials are working around the clock to respond to the outbreak of COVID-19 in all of our communities. Throughout this crisis, our community has shown that together we're strong and we can overcome COVID-19. Our community is strong and our nation is strong. As your federal representative, I will be here to support you through this crisis and well beyond. My team and I, just to assure you, we are working 24/7 to assist our community members. We brought constituents home who were stranded abroad, helped our small businesses get aid in time of this great need, and work to protect our frontline healthcare workers by providing the necessary supplies and resources, and partnered with local medical experts to educate the public on this circumstance. If you have questions or need assistance during this time of uncertainty, please do not hesitate to reach out to my office at any time. You can reach us at 717-603-4980. Now, before I kick it off to our experts, I just want to give you an update of what's happening in Washington, D.C. And while I do that, just if you do have a question or anticipating a question, I want you to dial star or press *3 now to get in the queue. We are also streaming today's call on 91.1. That's an FM station in the district. So if you're listening on the radio, you can ask a question by logging onto our Facebook page, where you find post-streaming the town hall, and you can submit your question there. Now, congressional action. Last night, around 1:30, the White House and the Senate leaders struck a deal for essentially a $2 trillion economic rescue package for individuals and businesses impacted by COVID-19. The Senate negotiators just released the text about an hour ago. I think it's about 935 pages or so. Me and my staff are in the process of reviewing the legislation. Here's what I can tell you about the bill so far. $1,200 checks to individuals, with a gradual decrease for those who make more than $75,000 individually, or married couple earning $150,000 together annually. Families will also receive $500 per dependent. There are $367 billion loan program to help small businesses, and I understand that will be coming from Treasury through our local banks and credit unions. There's $500 billion to subsidize loans for bigger businesses, and of course they will be overseen by the Inspector General. There are $130 billion for our local hospitals, $150 billion for spending to the states and local governments, and $250 billion in unemployment compensation increases and benefits. This will be the third coronavirus package signed into law. 3 weeks ago, the president signed legislation providing over $8 billion for the coronavirus response. This money went to test, distribution, vaccine development, and resources to state and local officials to deal with it. And then 2 weeks ago, Congress passed and the President signed into law the $53 billion package that provides free tests to all Americans and aid to small business employees and families most affected by the outbreak. And of course, that's a moving target. As of this time, we have tested more in 8 weeks in the United States than South Korea has tested since the beginning of the outbreak. The President has also declared a national emergency that allowed states, territories, and tribes to access over $42 billion in existing set-aside funding. Additionally, last week, Pennsylvania small business impacted by coronavirus received final federal approval to seek loans of up to $2 million as part of the U.S. Small Business Administration's Economic Injury Disaster Loan Program. Now, this is fast-moving and changes often, so for the most up-to-date information on COVID-19 and the federal government's response, I just ask you to please visit www.coronavirus.gov, http://www.coronavirus.gov. You can get the information, most up-to-date information there. And with that, what I'd like to do now is turn the conversation over to Dr. John Goldman, 4 or 5, 10 minutes of his update, and then we'll continue with George Donovus at that point. John, Dr. Goldman, can you begin your presentation now?
Absolutely, Congressman. Thank you very much for having me. So first of all, as many of you know, the COVID-19 is what's called a novel coronavirus. A coronavirus is the virus that normally causes things like the common cold. It's probably a virus that originated in bats, began circulating in the live animal markets in Wuhan, China, and then eventually spread to people. What makes this virus different than other coronaviruses is that because it's from another species, because it normally did not circulate in human, people are not immune to it. So it spreads quickly in the population. It spreads quickly among people. It actually spreads a little bit more quickly than the flu. So on average, if you have the flu, you probably infect 2 other people. So the average person with the flu spreads it on to 2 other people. This virus, the average person that has coronavirus, spreads it on to about 2.5. So compared to the flu, it spreads a little more easily. In addition, it is a lot more deadly than the flu. So during our typical flu season, of the people who get the flu, roughly 0.1%, 1 out of 1,000, will die from the flu. This virus has a mortality somewhere between 1% and 4%. If you look at the mortality, the number of cases in the United States and the number of people who died, right now in the United States, about 1.4% of the people who get this virus die from it. So 1.4 out of 100 as opposed to 1 out of 1,000. In addition, of everyone who gets the flu, about 2%, 2 out of 100, end up hospitalized, probably between 10 and 15%. Instead of 2 out of 100, 10 to 15 out of 100 end up hospitalized with this virus. So it infects more, it has the potential to infect a lot more people. It causes a lot more hospitalizations. It causes a lot more people to end up in the intensive care unit, and it causes a lot more people to die. We are in the middle of a rapid increase in the number of cases in this country. So if you were to look all the way back to March 1st, so less than 4 weeks ago, in the United States, we had 74 confirmed cases. We now have about 60,000. Most people assume that for every case that are confirmed, we have about 5 to 10 other cases. So we probably have between 300,000 and a little over 500,000 people in the country who are now infected. We've been relatively fortunate in Pennsylvania in that currently there are only about 1,000 cases. It tends to be centered closer to Philadelphia, and it seems to be moving westward through the state. We're fortunate that in our area, in central Pennsylvania, they're probably in the range of about 50 confirmed cases, so somewhere between 300 and 500 cases circulating. Up until a very short time ago, we mainly saw cases in people who had risk factors. They had a known contact of someone with COVID, or they had traveled to a country that had where they could have gotten COVID. We are beginning to see people who have come in with no known risk factors. They haven't traveled, they haven't had contact with anyone, they haven't had contact with someone who traveled. The fortunate thing is, compared to a lot of the rest of the United States, particularly compared to New York, New Jersey, to some extent to Philadelphia, we are still early in this infection. We are still early in the stage. So the social distancing, the closing of the schools, the having people not go to work and keep away from other people, especially if they're sick, really has great potential to slow this down. We are still at an early stage in central Pennsylvania. The important thing to remember is if you have 100,000 people infected and they all come in within 2 weeks, we have a lot of potential to tax the medical system. If, on the other hand, that same 100,000 people who are infected come in over 2 months, the hospitals, the urgent cares, the emergency rooms have a much easier time dealing with handling that volume of patients. One of the things that has been said is, well, this is a disease that for the most part affects older people. And in fact, if you look at the death rates in Italy, in China, they'd go up as you get older. They're probably about 2.4% in younger people less than the age of 50. Around the age of 50, they go up to about 1 or 2%. 60 to 70, they go up to about 3 or 4. 70 to 80, they go up to 7 or 8. And above 80, they've been reported as high as 15%. And they've been reported to be higher with people with other conditions, especially more than one condition. With that said, we have at least 2 young people at UPMC Pinnacle who are in the intensive care unit on ventilators and are as sick as you can be. So people shouldn't fool themselves and think, well, this is only a disease that affects people who are older. At least in our area, at least early in the course of the epidemic, we're seeing it affect all ages. Thank you.
All right, Doc, I sure appreciate it. Now we're going to turn to George Donovus, who is on the front lines in the emergency rooms at Pinnacle, and it's a practitioner who's right there. George, are you on the line?
I am, sir. How are you?
I'm well. George, thanks so much for your participation. You can go ahead with your presentation, and then we'll get right to questions.
I appreciate it. Dr. Goldman, thank you very much. I appreciate you guys taking the time to talk. So I have some things I was going to just sort of mention, and we'll get through it. So first and foremost, I think it's important to say, tips to staying healthy and reducing the spread of COVID-19. I would say staying home and minimizing the contact with others as much as possible, I think, is a really important thing to keep in mind. Washing your hands frequently with soap and water, or if you obviously don't have access to that, hand sanitizer is extremely important. But I want to emphasize the importance of washing your hands. And, briefly I'll mention, you should really be washing your hands for at least 20 seconds with soap and water, and really making sure that you do that correctly. A lot of us don't take the time to think of that. I want to emphasize the importance of that. If you're going to cough or sneeze, try and do it into your elbow or tissue, and make sure you throw that away, because obviously that's important to get rid of. If you're sick, ideally it would be, staying home if you're sick. And certainly we'll talk about how to get access to medical care if that's a concern. CDC does not recommend healthy people use face masks at this time. Hand washing and avoiding touching the face are much more effective interventions. For the community members who suspect they may have COVID-19, I will tell you that, if you have shortness of breath, difficulty breathing, obviously you're having respiratory issues, then certainly, that is a time where you may need to come into the ER. But there's also the opportunity to do a virtual visit. Some of you may be familiar with telemedicine, and that may be an option. And certainly going to the upmcpinnacle.com COVID-19 website is certainly where you have an opportunity to look at that. Doing this from home is really one of the best ways you can do it. You can see a provider as a virtual visit and obviously discuss your care in the privacy of your home. If you have a high fever or breathing trouble, going to the local ER, if that provider says, I think this is something we need to do, we're ready to take care of you. We are ready to do it. But the emphasis is trying to practice social distancing. Again, staying home as much as you can, avoiding public spaces is really important, keeping at least 6 feet between you and the other individual. Whatever you do, don't attend, a large gathering, and if possible, avoid using a mass transit. The importance of social distancing, I want to emphasize this, is because, we know that coronavirus spreads with an infected person coughing, droplets going into the air. Certainly that's one area that we always want to emphasize of staying away from. This can be breathed in, and so if you touch a surface, you don't wash your hands, you touch yourself, you touch somebody else, that's certainly the way that it can be transmitted. And so the ideal goal in fighting an epidemic or pandemic in this instance is completely halting the spread. Slowing it down is pretty critical too. As Dr. Goldman mentioned, we certainly won't want to give ourselves time to be able to take care of people as they come in. We want to reduce as many cases as possible. And it gives us time as medical providers, in the hospitals to sort of get prepared for when it's going to have to happen. As far as UPMC potential cases, as healthcare providers, we're using appropriate precautions through the system that we discuss every single day. We have updates as to what we need to do to help protect ourselves. Our staff and our visitor policies are always, looked at. Our supply chain for where we are in the ER and the hospital itself, we have a very solid structure in place, and our supply chain is in good shape. We keep track of this locally. We're making sure that it's in secure areas and nothing is going to waste. I can tell you right now, we are very good at being accountable for that. For our employee safety, I can mention that, we're on the forefront, making sure that we do everything that's possible, following CDC guidelines, making sure we use the protective personal equipment guidelines that we are set out to by the CDC. And what I'll mention with that is that, we follow those guidelines very strictly. They are constantly changing and evolving, and we are making sure that we follow those guidelines. And then lastly, what I'll mention is, the privacy of our patients is extremely important. We will never identify, patients that obviously get screened or are positive for that, because it is our importance to make sure that, our patients are kept safe and healthy. And, for those people that we're treating, we're making sure that we do everything that is set out by the guidelines. And so I will say that and certainly address any questions that you guys may have. Thank you.
Well, thank you, George. And to Dr. Goldman and to George, I'm going to start the questioning. And if you do have a question, press *3 and we'll get you in the queue. But in the meantime, I think one of the questions that we're all going to have, because it seems to be changing pretty rapidly, is the testing paradigms, requirements, availability, understanding that testing is probably being sent most to the places where it's needed most, New York, Philadelphia, et cetera. But people are interested, they're concerned, they might be exhibiting some symptoms. Can either of you give us kind of the latest on what the testing protocols, availability, et cetera, are? We heard on another event that a temperature of 100.9 was the minimum, and you had to be recommended for the test by your practitioner. And then talk about how you don't just, if you suspect you're sick, and especially if you have COVID-19 or coronavirus, you don't just show up at your hospital or your family physician. You alert them ahead of time so that they are prepared and that they can receive you accordingly, so that you don't also jeopardize other patients that might be there for the same thing or something completely different. Can you can either or both of you address the testing circumstances for our listening audience?
Certainly, Congressman. Well, first of all, the amount of testing is rapidly increasing. As recently as 1 to 2 weeks ago, most of the testing was available only through the Department of Health. We now have it available through the Department of Health, through several private labs, and through and also for us through UPMC. I do want to emphasize that you should, first of all, that asymptomatic people should not be tested. So if you are not having symptoms, there is really no value in the test. The test and the accuracy, even if you've been exposed, if you're not having symptoms, just simply isn't established. It can't rule you out from having the infection a day or two later. The first step is to call your primary care physician. You should let your primary care physician know that you are worried that you might have COVID. COVID can be spread by face-to-face contact, and you do not want to come into a doctor's office and possibly expose the people in the waiting room, possibly expose possibly expose the office staff and your provider. Most of the primary care physicians will either instruct you how to safely visit the office or refer you to a testing center. If you are sick, so if you have high fevers, shortness of breath, if you feel like even if COVID wasn't around, you are sick enough that you would need to see your doctor urgently, you should call your primary care physician. If you're going to the emergency room, you should let them know you're going, and you should let them know you might have COVID. Most of the ER at UPMC Pinnacle, you will be instructed to call into the emergency room. Someone will meet you outside of the emergency room before you enter, put a mask on, and escort you to one of the rooms we use for COVID patients. We have it, and we previously were doing a lot of testing in people who had risk factors, had traveled to another country, had a known exposure, or just had gotten really sick really quickly. Now we are beginning to test more people that simply might have the disease, and as the test becomes more available, we'll test more and more people with who are less and less sick. Two things I want to emphasize. One is if you are not sick right now, you do not need the test. You should not be trying to get the test just to see if you have the virus. If the test is negative today, there's nothing to say that you won't get it 2 or 3 days from now. So it doesn't clear you. The second thing is that if you think you need to be tested for COVID, you need to call your primary care physician. You need to, and if you're sick enough to go to an emergency room, you need to call the emergency room first. Thank you.
Well, thanks for the answer. Again, press *3. I'm just going to take questions as they come. So if our assistant Laura is on the phone, can you give us our first question?
Yes, the first question comes from Steph E.
Okay, you on the line? Go ahead.
Oh, I'm sorry. I wasn't expecting to talk again. Hi, I am a home health nurse, so I go into homes to see patients. We are being directed to wear a full PPE for every patient now. That just changed as of this morning, which would require us to wear surgical mask, gown, gloves, and a face shield. into all of our patients, and I am quite concerned with the lack of supply, at least at our level currently. I know that there was a general statement that they're going to be getting supplies out, but we are having to reuse our N95 respirators when we do have staff that use that. And just, yeah, there's just a general concern that we're going to run out of what we need.
Doc, can you let us know what UPMC is doing about that, and then I'll talk about the bigger policy ramifications of the question. Thank you, Steph, for the question.
Certainly. I think we are all concerned about the supply of personal protective equipment, gowns, gloves, masks. We've seen the demand for these skyrocket since the start of this epidemic, and we've seen the demand for these skyrocket all around the world. At UPMC, we are literally searching the world for any of these, for anything. We're literally searching the world for personal protective equipment. We're using all of our suppliers. We're using new suppliers. And I can tell you that for now, we clearly have adequate personal protective equipment to protect our staff and to protect our patients. And that's really from a big effort to make sure that we have enough on hand from our supply chain across the state and actually across the world.
Well, I sure appreciate it, Doc. And from the national response, we're very aware and also rightly concerned about the potential for shortages of PPE for our practitioners and our frontline responders. And as the good doctor has said, we have taken precautions to make sure that the stock is available. Now, what does that mean? That means a couple things. First of all, the president declared that it's a national military response whereby the president can dictate and direct that certain companies that may have produced something similar or in the same line produce the items that we need, and of course contract to do that, and that is indeed happening. He has, even though he's invoked the executive order, it's all so far generally been happening voluntarily. And I want to let you know, right here at home as well, we've had numerous companies contact us and we put them in contact with Health and Human Services to start manufacturing things that they had never manufactured before in terms of PPE, because unfortunately much of this comes from China, and they have had either such a great need themselves or have just refused to export it to us in our time of need. And so we have taken those steps. There's also a national emergency stockpile, and I think and I just want to be cautioned because I want to make sure that I'm correct on this, and I just need to double check. But at this time, I think half of that stockpile is now available, and it goes particularly and primarily, at least in the onset, to the centers that are equipped to handle best and certified to handle best the coronavirus or the COVID-19 outbreak. And so there's going to be increased production, release of the stockpile, the emergency stockpile, and use of all the means of the federal government to make sure that our healthcare providers have the adequate equipment and material that they need. I sure appreciate the question, and I know it's on a lot of people's minds, so thanks for asking it. Again, dial *3. Laura, do you have the next question, please?
The next question is from Alice B.
Okay, Alice, go ahead and ask your question.
Okay, my question is, yesterday I went to my primary care physician because I had been coughing a lot and I had coughed up blood. She was concerned about that enough to call the Department of Health, and the gentleman she spoke to said, I had a sore throat, and the week before I had random crazy diarrhea. It was just crazy weird, and they said I didn't meet the criteria. So it's pretty unsettling when your doctor wants you to be tested and you can't get a test.
George, you're on the front lines of this. Can you help Alice out here about the protocol and why it might be, as she describes, what the rationale is there? Make some sense to her of this and tell her what she should expect next.
Yes, sir. I'm happy to address that, and thank you for your question, ma'am. So,
You're welcome.
So in instances like this, certainly as medical providers, we always look to the CDC and the Department of Health. And,
Right.
in instances like this, what I can tell you is if we as providers have a question and we, can't find that information in real time, we reach out to the Department of Health and we say, listen, this is the case that we have, or in the instance of infectious disease doctors like Dr. Goldman, if we reach out and say, this is the case presentation that we have, this is how the patient appears, we go off those guidelines that are provided to us at a real time. Now, certainly that can change at any time, as this is a very fluid circumstance. However, certainly it is not, harmful to ask and inquire. And if the
Right.
Department of Health says, listen, at this point, we don't feel like this is what's going on, then due diligence has been provided in their instance and it's been done. But again, those cases vary, case-by-case basis. And then certainly Dr. Goldman, I think, could obviously attest to that. But that is sort of how we proceed with that. We review the policy, we make the calls, and we make the decision based on the guidance of that individual.
George,
Okay.
should Alice wait a certain amount of time if the symptoms remain, and then I know I'm trying to be careful here. I don't want to. Yeah, but what's the way forward for her? How long does she wait? So on and so forth before she asks again, because it's hard to have peace of mind when you're concerned and you're just told to wait. So do you have an idea? I mean, is there a normal protocol for something like that?
So I wouldn't say that certainly waiting, because, instances change, especially with people's health. But, I mean, certainly if you feel concerned enough and there's an underlying concern, calling that primary care doctor's office and saying, listen, these are my symptoms. This is how long this has been going on for. Can we either schedule a virtual, examination or discussion? And then at that point, I think it's really helpful. And sir, this is really where telemedicine can make a big difference, is that provider can examine that individual and make that decision based on real-time information. And I strongly encourage people to really consider that, because, that can really make a difference just by doing that. So if you're concerned, call. There's, calling and certainly saying, this is what my symptoms are. I wouldn't tell anyone to wait a specific time because, as you know, things can change. Your health can change. But if you're concerned, I think reaching out is always the first step.
Right. And I was there yesterday, and she was concerned enough to call, but, I didn't have all the symptoms. I don't have a fever or anything like that. So it's just concerning to me that our doctors are recommending, but we can't get tested. And that's the problem. When are more test kits going to be available to the public?
I can definitely appreciate that frustration, and certainly again, I would say to you respectfully, ma'am, I think every provider has a decision and that capability to make, and certainly reaching out to the people at the Department of Health who obviously are getting this information and doing obviously decisions that they think are right in that instance, but understand that it's a collaborative decision. It is a decision that is made between the provider and the Department of Health. And again, that information, passing that along. And if they say, listen, we don't feel like this person is a risk, or we don't feel like that person should be tested right now, then that's fine. But understand that that condition can change. And so it's important, if your condition does change, to call back and say, this is where I am. And so certainly if Dr. Goldman would like to discuss any of that, also that would be helpful.
No, absolutely. One of the problems that we're having with COVID is that it has a non-specific presentation in English. It can present like the flu. It can present like a common cold. I think many of us have been surprised to learn that it can present with a lot of GI symptoms and diarrhea. And on one hand, we want to find every case of COVID that is out there. At the same time, we're fortunate enough in this area, it's still a little bit uncommon. And so, in fact, if you're presenting like the flu, you could have COVID, but you're still most likely to have the flu. I agree with you. I think that it is extremely frustrating when your physician says, I'd like to get COVID testing, and you can't get it.
Right.
One of the things that the Department of Health is working on is increasing its capacity. We have a number of private labs, and in fact, the capacity to test people is going up literally every day. My suggestion to you is to follow up with your primary care physician, and especially if you're not getting better, have them re-request COVID testing, either through the Department of Health or through one of the health systems that's currently providing it.
Okay.
Alice,
Thank you.
I appreciate your question, and it informs me because, like you, we've been told over and over again that if your practitioner, if your physician recommends the test, then you can't just walk in and request it yourself, but if the physician recommends the test, then the test will be given. So the fact that there's a disconnect between your physician and the Department of Health needs to be, we need to figure that out. So I appreciate the question, and we're going to ask the question because we want to make sure that the Department of Health obviously is in a collaborative way, understanding that if the physician recommends it, that's what people are being told needs to happen. And if that's not the case, we certainly need to know why that is the circumstance and like I said, the way forward. So I sure appreciate the question.
Thank you. Thank you for your time.
Thank you. All right, Laura, did we have the next question, please?
The next question is from Ann P.
Hi, Congressman and doctor and nurse practitioner. I'm very appreciative, all three of you, of what you're doing. And right now, it's dangerous work in your different work environments, but we are at a really critical juncture in history, no doubt about it. I was very alarmed yesterday as I watched the White House briefing, which I have done every day, to see the arbitrary date being put forward as Easter, where generally the country, maybe in phases, will be being put back to some sense of normalcy. Given, Doctor, what you've just explained and really the ferociousness of this virus, and I mean, this is the most serious foe we've, as a country, have faced since 1918. I have grave concerns that if strong voices, and Congressman, this is pretty much where my question comes into you, and I know your stellar background and your high level of great intelligence, and I'm imploring you, but I'm going to ask you that your voice on the floor of Congress, what forums will be available to put some common sense and scientific thought processes into kind of the absurd reasoning we were hearing to put arbitrary dates on a pandemic that we already have all the facts on this microbe and how unbelievable fatal it can be. And it's not doing things, those kind of public statements are very alarming. Right now the leadership we should be hearing, and this is where I would appreciate, Congressman, you go back into your quorums, into your majorities, into your committees to express what the American people expect and need to hear. And it isn't that, because we certainly know as they go, the scientists just went on the cruise ship that was parked in, I believe, San Francisco. And here, lo and behold, what are they finding after all the patients disembarked? That, in fact, that microbe can live for 17 days on those hard surfaces. Now, the prior data was showing that 3 to 4 days on things like metal and plastic. Well, no, it obviously is very virulent. And so I guess what my question is, Congressman, is just very generally, what is your voice and your factual opinion on our slow process of conquering this foe and, safely protecting our communities without putting some type of unscientific approach to combating it?
And I appreciate the question, and it is a tough line for anybody, whether it's the governor, any elected officials, to walk here as we figure this thing out. And just like the doctor said, I think heretofore we're kind of unaware of it being symptomatic in the GI tract, but maybe that is now the case, and so we're still learning about this and how it's transmitted, contact surfaces, like you said, the amount of time it lives on hard surfaces versus fabric, aerosolized transmission versus where they're droplets as opposed to whether they dry and are still transmittable. We're still learning about this. So we're trying to figure that out, and when is going to be the time where people can kind of get back to their daily lives. And it is a tough thing to determine. We kind of look towards other areas that have experienced it and try and see where we fit in as a country into the timeline of the spread of the virus. But we also understand that different countries and, quite honestly, different states and localities have taken different approaches, and so that affects the spread of it. And I think that, unfortunately, everybody, including school students and business people and just your average everyday citizen that might not be connected to a group, are wondering, how long is this going to last, and what can I expect? Because they're mindful of the effects of it across the United States and across the world, and so people want to have some idea of something certain. And I think that that as leaders, we have to be mindful of the science, and I think that the administration has been surrounded by Dr. Fauci, our good graduate from Penn State, that's been giving the daily briefings on this, and it's kind of it's moving, and it is hard to determine. But people want to be able to look towards the future and say, well, when do you think it might be? And of course, none of us can really say. But we have things that we hope for, and we want to give people hope that this is going to be over, and it is going to be over at some point. Of course, the weather might potentially play a factor. We're trying to determine that as well, but that is currently, as far as I know, that is unknown, how much or if the weather will play a factor like it does in other coronaviruses. And so I think it is a delicate dance, but I can assure you that between the federal response, both in Congress and at the administration, working with our state partners, and that would be the governor's office, and as well as our practitioners right here at home, we're going to make the level best decision we can to make sure that we are clear of it before we get back to business as normal. And if you talk to the governor, who, in this case, governors have the complete authority in this regard to deal with when people go back to work in earnest and so on and so forth. The governor has basically stated that he has a metric that he's looking at where the number of infections are decreasing at a very rapid rate, or there's no new infections at a very rapid rate for a period of time. And whether that happens by Easter or not, it remains to be seen. And we will make the decision, of course, as we see those metrics, and all collectively make the determination that we are kind of over the hump, so to speak, and beyond the danger zone for all components of our population. At the same time, we do want to give people encouragement that this is not going to last forever, and if we do the right things, that we will find our way out of this one, just like we have in the past 100 years ago, and every other thing that America has had to struggle to get through. We will get through it together. But I do appreciate your sentiments and your question, Ann. Thank you. And with that, Laura, is there another question?
The next question is from Barbara G.
Go ahead, Barbara, if you're on the line.
Hey, I just, with this stimulus package, does it include Social Security people? And also, with this order for stay at home, what is expected of individuals as a 71-year-old person with COPD? How do I know the difference between symptoms of the COPD and the virus?
Okay, so it's my understanding, Barbara, that, and I just want to caveat this, you know, these agreements, so to speak, legislatively, I understand there's an agreement. We understood there was one before, and that kind of fell apart a day or two ago. So we understand there's agreement. That's number one. We hope that there can be and that we can move forward, but I just want to caveat it. These things sometimes fall apart. So, and what I currently think I understand this is a bill we received about an hour and a half ago of over about 930 pages or something like that. But my understanding is even though if you're a Social Security recipient, it's all based on your income level. So if you're an individual below $75,000, that meets the threshold, or a couple below $150,000 annually. So that should answer that. But that's as I currently understand it, Barbara. And so let's just give us a little time to read through the bill, and then let's also, you know, I hate to say it this way, let's not count our chickens just quite yet until the vote is finally cast, because that's what really seals the thing. Up until then, you just never know. And then finally, regarding your question on COPD, I'm not a practitioner, and certainly whether George or Dr. Goldman want to weigh in, I would think don't leave it up to your own questioning. Just call your practitioner and let them know what you're experiencing, and they will be able to advise you appropriately. But Dr. Goldman, do you want to weigh in on that portion of the question?
Certainly. If you have COPD can cause shortness of breath, which is the same which COVID virus can also cause. On the other hand, if you have COVID virus, you are likely to have a fever. You won't get a fever with your normal emphysema, and you're likely to be more short of breath than usual. So if you have your baseline symptoms that you typically have with your COPD, I wouldn't worry. If, on the other hand, you have a lot more shortness of breath than usual, or especially if you have a fever, then you should contact your doctor. That might be a sign that you have COVID. It may be a sign that you have many of the other respiratory viruses that are going around right now.
Well, thank you. Thank you very much for that, Doctor and Barbara. I hope that does answer your question. Again, dial *3 if you have a question. Laura, is there another question on the line? Laura, are you there?
Yes, I am. The next question is from Mary Ann D.
Go ahead, Mary Ann.
Hello? Hello?
Hello. Go ahead with your question, Mary Ann.
Yes, Scott. Thank you for taking my call. It's been reported recently that some people are experiencing a loss of sense of smell and taste, and then this has been associated with the COVID-19 virus. So I'm wondering if a person is experiencing this, and these symptoms can also occur with the common cold. And so if this is the only symptom that the person is experiencing in the absence of a fever or a cough, is this something that would warrant testing? And with the occurrence of this symptom, do we know how many patients or people have been tested only on these symptoms, and how many have been positive and how many have been negative?
Wow, great question. Hey, George, you're right at the receiving end of this stuff. What can you tell Mary Ann and the rest of us listening about those symptoms and its relation to coronavirus?
Yes, sir. Absolutely. Ma'am, that's an excellent question. I appreciate you taking the time to ask it. So I think what I would say to you is if those are really your only symptoms, and again, you're not experiencing a fever or shortness of breath or cough, I mean, certainly it's something to take note. But if you're not having, other symptoms of that, I would tell you to monitor that, call your doctor and let them know, because again, we're not going to test people in an instance where they're not having necessarily those symptoms. But this is really the importance of where that telemedicine call or that call to your primary care doctor would be made. And so certainly that is an avenue that I would tell you to consider taking. And at that point, having that discussion with your primary care or that virtual care visit would be done. Certainly they could gauge those symptoms and see whether or not that would be something that necessarily you would have to be tested for. But that would be a really great way of doing that. In my opinion, if I was to see something like that, I would not necessarily say that that person should be tested, especially if they've not come in contact with a COVID-19 person or recently traveled to put them in a risk position like that. And so certainly if Dr. Goldman had any comments on that, I would appreciate that. But that's how I would respond to that question if that fulfills your answer.
So certainly, first of all, this is one of the diseases that we are really rapidly learning a lot about. So as I talked about, we're now getting reports that you can have that it can present with more of a gastrointestinal illness. And one of the things that is reported is that you can lose your sense of taste and lose your sense of smell. And unfortunately, I can't tell you how often this occurs with COVID. We just know that it can occur, and I can't give you any kind of idea of how often people have been tested for it and how often those kind of people with those kind of symptoms are positive when you test them. Unfortunately, this is a disease where we're learning a lot about it rapidly. It's a new disease. The world up until earlier this year had never seen it before. So it's one of the times in medicine where we often have to try to diagnose and treat people when we don't have complete information. What I would tell you is if it's an unusual symptom, definitely call your doctor. And if you're having other symptoms, especially fevers, especially cough, especially shortness of breath, then you may be at higher risk of having COVID. On the other hand, since those loss of taste, loss of smell can occur with other diseases, it certainly isn't diagnostic. If that happens to you, it doesn't mean you have COVID. It means you may have it, but we can't tell you at this point how likely that is. You'll have to be evaluated by your physician.
Thanks so much for the call, Marianne, and an interesting question, and it informs us all. With that, Laura, is there the next question on the line?
Our next question is from Tina.
Hi, Scott. I have a question about picking up the virus at the grocery store or on your mailbox handle. How long can the virus live on, like if you go get your mail and the mailman just picked up from somebody on the route that was positive and that person didn't really think they were sick, do you have to worry about that? And when you get your groceries, the things on the shelf, how long will it live on that? Do you have to worry about, picking up the virus and bringing it home from the grocery store?
Great question. Dr. Goldman, can you give us what you know is the latest? This kind of goes also, not only Tina, but Barbara mentioned something about this. Can you tell us a little more about what the latest is regarding how long it lasts on contact surfaces and transmittability?
We've had reports that it lasts for up to a couple of days. That would be unusual for most viruses. I think what is fair to say is that it's likely to last for a couple of hours. The coronavirus, like many of the same cold viruses, many of the flu viruses, lives on surfaces. Now, it's typically when someone either coughs on the surface or coughs into their hands and then touches the surface. There are two things that you can do to greatly decrease your risk. The first is simply wash your hands frequently. I have a little thing of hand sanitizer on my desk in the hospital. I wash my hands before and after absolutely every patient. So washing your hands prevents you from getting it on your hands. Most of us then infect ourselves. If we get it on our hands, most of us then infect ourselves by touching their face. On average, most of us touch our face 15 to 20 times an hour. So washing your hands frequently, using hand sanitizer frequently will really decrease your chances of getting the virus and making an effort not to touch your face. Unfortunately, when people become conscious of how often they touch their face, they often find a hard time stopping. So it takes conscious effort. What I would suggest is people practice prudent caution, meaning wash the hands frequently. Don't try not to touch your face. On the other hand, if it is very unlikely you're going to get it from the mail. It's more likely that you would get it from the mail. It's from something that's come from China, and it's usually from high-touch surfaces, doorknobs, light switches, stuff like that, where a lot of people have touched them. And the best way to protect against it is when you have to go out, wash your hands frequently and try to keep your hands away from your face. And I'd give you that advice even if there wasn't coronavirus around. That's one of the best advice you can take during cold and flu season, and people who do that will end up with less colds, will end up with less flus, and will end up with less coronavirus.
And I will tell you this too, Tina, and the doc didn't recommend this, but I have seen people at the store or just about wearing gloves of different kind. And one of the things, it's not necessarily only just to keep the virus off their hands, but with a glove on, you're conscious of when you touch your face, and it kind of is a deterrent when you're wearing a glove, especially maybe a rubber glove, to touching your face. So that might be something you might want to consider. It's not optimal, obviously, but I think it does give us peace of mind, what the doctor said about how we can stay safe, go to the grocery store as we need to, and get the mail and things like that. But you do have to be aware, and that's why practitioners are recommending hand washing over and over. We might be sick of hearing it, but it makes a big, big difference. That's my understanding. So I appreciate very much the question, Tina. Laura, is there another question on the line?
Our next question comes from Larry T.
Hi, Larry.
Hello. Hi, Scott. Question is more on the economic impact of all of this here. Some general information. You may not have the answers because you have the large bill that's in front of you, but I'm hearing broad stroke comments about bailouts, and then I'm hearing small business loans. I'm hearing the large companies, airlines, cruise ship industries getting large bailouts, and then when it comes to the small lifeblood of our country, as I've read, that we're to be expected to possibly take out loans. And I'm assuming by the definition, a loan means repayment at some point. So my concern is that the small business men and women of this country, from what I read is over 30 million of us, we may not have, the singleness of, thousands and thousands of employees, but, my dozen employees are equally as important as in a group as the big airlines and the big business that is out there. My concern is if we take out loans, the ability to repay these loans to our government and to our local bankers who are going to require that. Any thoughts about how that works? I mean, my grassroots level, I'm not a Wharton Business School graduate by any stretch, but I've been in business for many, many years, is that the business that we all are going to lose, the restaurateurs, the small businessmen like myself, the business that we are potentially going to lose in the next 3 to 6 months is not recoverable from to possibly be able to pay those loans back. Any comments on anything like that?
Absolutely, and I'm so glad you asked the question, Larry, because I've asked similar questions of the Senate, and just to let you know, this bill is completely crafted in the Senate. We have offered our viewpoints, but it's not happening in the House. We will have apparently or allegedly a chance to vote yes or no on the bill, but as far as, sitting in the room and saying, well, we should put this in it or that's crazy, we shouldn't have that in it, that hasn't really been the purview of rank and file House members. That having been said, it's my understanding that one of the many provisions of the bill, especially for small business, is that while it will be a loan in some cases, one of the provisions will be that if you continue to keep your staff on, so you have 12 employees that are dependent upon you and your business for their mortgages, their car payments, their student loans, their dreams. If you keep them on, then that's what this money is for, and you will not be required to repay it. So it should be, and I think the goal or the vision is for it to be an incentive for you to keep your employees on and to help you do that, even though we understand, I think, obviously, that a loan's great, but you have to be able to repay it, and you need money coming in to repay it, and that's what this is all about. There's no money coming in because businesses are being shut down, and in many cases being ordered to shut down by your state or federal government, and so the market cannot work in that context. So it would be either grants or loans, but with a certain proviso that if you can keep your employees on using those loans, then that is the repayment in and of itself. And then that's what all the additional money is for, that would go from the federal government to Treasury to the bank. And you, Larry, business owner who did the best thing in good faith, will be absolved of making the payment. And it is also my understanding within certain contexts that the bigger businesses, whether it's the cruise line or the airlines or somebody that has a strategic concern like Boeing, that they have similar but maybe not the same, but similar provisions that get to the same goal. That was the hope, and again, that's what we'll be looking for among other things in the bill that we look at. And it also includes, for your case, Larry, as a former business owner myself, unemployment compensation, and as you know, you are ineligible for that. And for people that own businesses that oftentimes go for a month or more without paying themselves because they got to make ends meet, pay the insurance, get their payroll out, the cost of doing business, sometimes your receivables don't come in. How do we calculate unemployment for those individuals? And those are questions that we've asked. I'm looking for that in the bill right now to see how that's going to be done. Quite honestly, on the unemployment question, it might come down to the states. The federal government might just grant the additional money with certain provisions to the states, and then have them adjudicate how they're going to determine what the right amounts are. So I just want to let you know, Larry, that these are the issues that you have enumerated regarding your business and all businesses in our Commonwealth like yours. This is what these have been my very similar and same concerns, and so hopefully we will address that appropriately as I have outlined. That is my understanding of the goal, though, and I appreciate the question. I hope that answers your question. And I would just say this, Larry, moving forward for you and any other small business, many businesses that are listening right now, as this moves forward, I would just encourage you to contact our office and the SBA and your local banks and credit unions to determine the exact policy, because it's going to be coming very rapidly, understanding that checks might go out within 2 weeks from right now. So that's how rapidly this might be evolving, and we want to be able to answer your questions. Larry, thanks so much for this opportunity and the question. Laura, is there another question on the line?
Yes, this will be our last question, and it comes from Val C.
Okay, Val.
Hello. We're going to ask you the question of how long do you think until a cure will be made?
Well, that's a tough question. I'm going to leave that to the healthcare practitioners. Doc, do you want to weigh in first? Dr. Goldman?
So, first of all, for most viruses, the best cure is really a vaccine to preventing the virus from ever infecting you. So if you look at some of the viruses that were scourges of people that really have through history infected a lot of people and killed a lot of people, smallpox, yellow fever, they are best treated but with a vaccine. So I think that we will probably have a vaccine in something like a year and a half, 2 years. There are some viruses that are treated with antivirals, so instead of just preventing the infection, you directly treat the virus. People are looking for people are looking for anything that might work against this virus. I think that we're going to have much more information in the next 6 months to a year. But for example, there was a lot of hope for a drug that was normally used to treat HIV called Kaletra. In the first trial that came out with this, the first one where they really studied it in people, there wasn't much of an effect. We should really note that for bacteria, we have literally hundreds of antibiotics, hundreds of drugs that kill those bacteria. For viruses, it's a lot more limited, so it's going to be harder to find a drug to cure this virus, and so the best hope is with a vaccine. If we get extremely lucky, it'll be 6 months. We have to get extremely lucky. Realistically, a year, year and a half, 2 years.
George, I want to give you an opportunity before I close up the call to weigh in on this, and I do have a comment as well. But go ahead, George, if you have something you want to add here.
Yes, sir. I appreciate it. So, at this point, as Dr. Goldman pointed out, certainly we have the greatest scientists and the minds in the world trying to obviously work together to come up with a vaccine for this. But what I'll tell you is the following, from the emergency room perspective, we're doing everything we can. We come to work every day to make sure that we're prepared to do what we need to do to keep our community safe. In the interim, what I ask everybody to do is, try and follow the rules. Stay home, wash your hands, try and keep yourself as healthy as possible with, the best immune system that you have available. And then that means getting plenty of sleep and hydrating and, obviously trying to stay healthy. Beyond that, this is what we have to do. And, keeping the social distance and exercising that due diligence of avoiding public spaces gives us the opportunity that we can to really try and fight this. I think as people, as Americans, we all have to come together as a common goal to fight a common enemy, which is this virus. And I do not think we will not be able to get through it. But that's the point that I would make to all of you, and I appreciate it.
Well, I first want to thank everybody for listening to the call and for your input and your questions. All of them are relevant to everyone listening, and we all become better informed because of your questions and the answers. I also want to thank very much Dr. John Goldman and George Donovus of UPMC Pinnacle, knowing that they are literally on the front lines of this, and we sure do appreciate your sacrifices in that regard and your being able to answer all our questions today. I want to encourage everybody, if you do continue to have questions that our office can be helpful with, like I said, we're out there 24/7 doing everything we can to get us through this. You can contact us at 717-603-4980. Regarding the vaccine, it's my understanding as well that we are well ahead of schedule compared to things like SARS and so on and so forth. Part of that was due to the administration reducing some of the barriers, the requirements for vaccine production, testing, and trials. And also, it's also my understanding that there are a lot of promising treatments out there with the use of old HIV drugs, old malaria drugs, and other things that are coming into the testing paradigm right now. I understand also that we are way ahead on that. So hopefully a vaccine will be much sooner than ever in the past regarding widespread availability. In the meantime, let's keep ourselves safe by following the doctor's order, so to speak, but also be hopeful that there are, I think, treatments that are going to be forthcoming that people that are afflicted with the coronavirus or COVID-19 can turn to as life-saving measures. And we're just the things we're doing right now, among other things, among keeping us safe, are buying us time to make sure that those things happen. With that, I sure appreciate it. This is Congressman Scott Perry signing off, and just make sure you stay in touch with our office. If you have questions, we will be here for you. Thank you very much, and have a great day.